Two Gids, how you doing today?
Good.
Back in my office again, huh? All right. Is there anything going on? Are you all right? I mean, you keep coming back here. I don't know.
I'm good.
You know. Yeah. Okay, good deal. All right. Well, today we're going to be doing a neurological examination. All right. So I'm going to be checking your cranial nerves, your sensory, your reflexes, different things along those lines, just to make sure everything's going all right between up here and the muscles that are innervated by what's going on between the ears. Sound good?
Yep.
All right, cool. So we'll go ahead and begin. The first thing, first cranial nerve I'm going to test, and that's what we've got, a bunch of cranial nerves. They're all the nerves in the head. So the first one I'm going to test is your sense of smell. And I'm just going to go ahead and ask you, do you have any problems with your sense of smell or taste or anything like that lately? No? No difference in smell between, one side and the other of the nose? You taste all your food just fine, right?
Mm-hmm.
Okay, good deal. So the olfactory nerves are intact. Otherwise, you would notice that you wouldn't be able to smell things very well at all. So I'm going to go ahead and do a fundoscopic evaluation on you. And we did this before during the head, ear, nose, and throat check. And what we're going to do is we're going to go ahead. First, I'm going to do is I'm going to check for your looking at your optic disc. So just like before. Okay. I'm going to have you stare at the wall out in front of you. Okay. Good. All right. Check the other one. Good. Man, I hear your kids out in the waiting room.
Pretty loud.
They're pretty loud, huh? Okay. All right. Wow. Okay. Good deal. So we're gonna check your visual acuity. So if you could read off that right there.
Ava, Avery, Raymond, and Alyssa.
Good. Okay. Your visual acuity is intact, and those are pretty small letters. So I know that you can read as well as see. So that's good. I'm going to check your visual fields. Okay. So in your eye movements, we're testing your the cranial nerves that are responsible for your ability to move the musculature in your eyes. Okay. So but first, actually, I'm going to check your make sure your pupils are reactive, which they are. Excellent. Okay, good deal there. Okay, so let's go ahead and do our. I'm gonna have you just follow my. Evaluating the 6 cardinal positions of gaze. Very good. Thank you. All right. So your eyelids, they open up and shut. Okay. No problems blinking or anything like that. I don't see any ptosis, any droopy eyelids. So we're happy to see that. All right. So the next thing I'm going to do is I'm going to go ahead and have you cover up your right eye there. Good. And what I want you to do is I want you to tell me when you're able to see my eye,
Mm-hmm.
my finger in your field of view. Okay.
No.
Good.
No.
Good.
No.
No.
No. No. No.
Good. All right. Other eye. Ready?
Yep.
You see it?
Yep.
Good.
Yes. Yes. Yes.
Good. Okay. Excellent. So that takes care of that. All right, let's see. We are going to check for facial sensation, okay? And what I am going to do is use something soft. In addition to something pointy, and then you're going to tell me which is which, okay? So close your eyes.
Hard. Hard.
Good. Okay, so that's that part. Next thing I'm going to do is I'm going to have you, we're going to check your jaw, all right? So if you could clench your teeth together. Good. Now move them side to side. Good. Back and forth. Excellent. Good job. Thank you. I'm going to go ahead and check your gag reflex, okay? So actually, first I'm going to look at your uvula and your soft palate. So say ah.
Ah.
Good. And move up and down. Great. Okay. Check your gag reflex. Good. Okay. That's all good. Okay. No problems with chewing or swallowing. When you swallow thin liquids, all is well. You don't have any difficulty with getting that kind of stuff down.
No.
Okay. Good deal. No problems chewing or anything along those lines, right? Good. If I can have you, I want you to raise your eyebrows. Good. Open them up. Shut. Good. Okay. So look up. All right. Good deal. Any problem? No, we said no problems with taste. I'm going to have you smile real big, okay? And I'm checking the symmetry of your smile. Good. Okay, now frown. Such a sad face, Mrs. Dugas. Go ahead and stick your tongue out at me. Good. I'm checking for symmetry. Everything's symmetrical there, as well as the smile. The smile is symmetrical. Nasolabial folds are good. No problems there. No mouth drooping out of one corner or the other. That could indicate neurological problems or strokes or anything along those lines. Can I get you to squeeze your eyes shut? Good. Okay. All right. I'm going to have you purse your lips. Good. Now puff your cheeks out. Good. Okay. Do me a favor and go ahead and take the tongue, and I want you to push against my finger. Good. I'm checking your tongue strength. Good. Okay. Very good. Say the letters B,
B,
M,
M,
and P.
P.
All right. Very good. The next test we're going to do is called we're going to do the Ren test and the Weber test. Okay. We're going to check your hearing. All right. So what I'm going to do is I'm going to put this. We did this a few weeks ago. So I'm going to take the tuning fork. I'm going to put it by your mastoid process right there, and I want you to tell me when the sound is gone. All right. At that point in time, you should still be able to hear it when I put the tuning fork up to your ear. Okay. Let me know when the sound's gone. Can you still hear it? Good. Yes?
I did.
Good.
Yes.
Okay. All right, other one? Is the sound gone?
Yes.
I think it's very gone. Okay. Let me know when it's gone. Okay. Still hear it?
Yes.
Good. Okay. Excellent. Excellent. Now we're going to do lateralization of sound. So I'm going to put this right here, and you should be able to hear sound. It shouldn't feel like it's coming or sound like it's coming from one side or the other. Okay. Where's it coming from?
Middle.
Both sounds. Okay. Both sides. Not one side or the other. More than the other. Okay. Good. So that's good. Now I'm going to do the whisper test. Okay. So what I'm going to do is I'm going to whisper a couple words into your ear, into one ear, and then I just want you to tell me what those words are. Okay. Or answer my question.
Mary.
Good.
November 18th.
Good. So long as we're doing dates, we're going to check your mentation and your cognition. You're having a conversation with me. We're doing well with that. So your cognition is fine as far as being able to hear what I'm saying. I don't hear a lot of what's or anything like that. So that's good. Can you tell me what the date is today?
May 6th, 2014.
Good. Who's the president?
Barack Obama.
Very good. What's your mom's birthday?
December 20th.
And your husband's birthday?
October 26th.
Very good. Okay. All right. And where are you right now?
The doctor's office.
At the doctor's office. Very good. Your doctor's office looks remarkably close to a kindergartner's room. It's really interesting. Must be a pediatric doctor's office that we're here to see. Yeah, okay. All right. So your we already checked your glossopharyngeal and your vagus nerves, phonation, your soft palate, uvula, all that good stuff. So next is I'm going to have you. We're going to check your accessory nerves. Okay. So I'm going to have you rotate your head, your neck. Okay, one side and the other. Good. And we're going to do a shoulder shrug. So I'm going to give you resistance here. Okay. So go ahead and shrug your shoulders. Good. Now I'm going to have you resist. Okay. Good. Okay. And try to push them up. Good. Okay. That is leading into our next exam in a few minutes. So that's the accessory nerve. Hypoglossal nerve is tongue protrusion. We already went over that. Lateral deviation of the tongue, tongue strength, the swallowing. Can you do me a favor and say the words L? I'm sorry, one. T.
T.
D.
D.
And N.
N.
Very good. Okay. All right. So next, what we're going to do is we're going to check your muscle tone, your balance. And this is just kind of a. I'm going to have you do a couple things, but also I'm kind of just making sure, looking at you, you don't have any ticks or clicks or anything like that. No ticks or tocks. That's a good thing. Walking out of the office today, your gait was good. Again, your hearing and speech is fine. So if I can have you do me a big favor, I'm going to have you stand up. Okay, we're going to check your just your muscle. There's muscle strength, and I'm just going to have you. I'm going to give you some resistance to some certain movements, and I just want you to resist what it is that I'm doing. Okay, so we're going to start off with your arms. Go ahead and try to get them out that way. Good. Bring them in. Excellent. Same thing. Bring them in. Good. Elbow. Pull it in. Good. Push it out. All right. Pull it in. Okay. Pull it in. Good. Push it out. Right. Wrist. Okay. I'm gonna bunch up your fingers, and I want you to try to spread them out for me. Okay. Okay. Spread them out. Good. Now I'm gonna make a fist. Good. And spread it out and try to break the fist. Good. Same thing on this hand. Excellent. Okay. Very good. So next we're gonna go ahead and I'm gonna have you. You can go ahead and sit back down. Actually, you know what? Yeah, from right there. Go ahead and put your arms up. Good. Put them both up. Try to resist. Good. Bring them down. Right. Now we're gonna do this with your legs. Bring it down. Good. Bring it down. Good. Up. Up. Your ankles. Down. Good. All right. I'm gonna go ahead and have you lay back on my exam table here. Good. Can you lay back further? There we go. Okay, that's cool. Right there. Good. So what I'm gonna have you do is put your legs up. Bring your knees up. Good. So I'm gonna have you push them in. Good. Out. Okay. Now I want you to rotate them. So go ahead and put this one down. Go ahead and rotate it in. Okay. Resist. Resist. Okay. And the other one, same thing. Push that way. And out. All right. Good job. You can go ahead and sit up. while I have you right there, I'm going to go ahead and do a couple of other things. Our Babinski sign. These are just we're going to end up getting into um, some sensory stuff in a few minutes, but since I already got you sitting on the table right there, I'm going to go ahead and do this. So good, good, and go ahead and lay back down. I'm going to put this on your abdomen, and I'm looking for good, continuous reflex there. All right, you can go ahead and sit up. All right, so now what we're going to do is the Romberg test and the and pronation. All right, so I'm going to have you stand up. Good. Arms to your side, please. Feet together. Good. Close your eyes and try not to like fall over.
Okay.
Very good. You passed. Go ahead and sit down again. All right, I'm going to have you put your arms out and palms up. Good. Close your eyes. And this is called pronate or drift. Very good. If you were to have had neurological damage, one arm might drift like that. So that's what I'm looking for there. So that's all good. Next thing we're going to do is rapid alternating movement. Okay, so what I'm going to have you do is put your hands out, and I'm going to have you do that and do it fast, real fast, as fast as you can. Good. Okay. If you had a stroke or neurological damage, you might not be able to do that. It might be it might look jerky. So we're going to go ahead and have. I want you to touch your thumb to. Okay, good. Next, we're going to have you. I'm going to have you touch your good. Touch your toe to my finger. Good. Other one. All right. Can you touch my fingers? Other hand. All right. So now what I'm going to have you do is I want you to move your heels up and down your shin. Good. Other one. Good. Okay. So now what I'm going to have you do is touch your finger to your nose. Good. And then to my finger. Good. Again. Yep. Do this all day. It's fun. Okay. Good. So now I'm going to have you stand up. Can you stand on one foot for me? Good. The other foot. All right. Can you hop on one foot? And the other foot? Both feet. Good. Now I'm going to have you just, if you could just walk for me for a second. I'm just going to check your gait. Good. Everything looks symmetrical and coordinated. Happy to see it. All right. Next, I'm going to have you walk heel to toe to the end of the table and back. All right. And you can turn around. Very good. Okay. Good deal. Hand grasps, please. Squeeze tight. Good. Okay. All right. Go ahead and sit down again. This is called stereoagnosis. Stereoagnosis. And what I've got is a few different objects here. Okay, there are a few different coins. I've got a nickel, a quarter, and a dime. I want you to tell me which one is in your hand. Go ahead and close your eyes.
A what?
A nickel, a quarter, and a dime.
Quarter.
Very good.
Dime.
Excellent.
Nickel.
You only get one hand. Okay.
A nickel.
Very good. Okay. All right. Good. Next, I'm going to check your. I've got a paper clip here, and I'm going to do a. Okay, I want you to tell me if I'm touching your finger with one tip or two. Okay.
1, 2, 1, 2, 1, 2.
Good. Hand.
2, 2, 1, 2.
Good. Now when I get to your shins, when I'm doing it down here, it's probably you might not be able to tell like you otherwise could. So it would take me being spread out further with points for you to be able to tell.
One,
Yep, that's actually 2, and I'm about an inch apart. So we'll spread it out further.
2,
Very good.
2,
Very good.
1,
Next, our hot cold test. Okay, I've got a warm object and a cold object. I want you to tell me, close your eyes, and tell me which one you're holding.
cold,
All right.
1,
Excellent. Okay. And same thing down here. I'm going to go down to your toes and do it. You just tell me which one this is.
cold,
Very good.
1,
And the other one?
cold.
Good. All right. Next, we're going to do something called graphesthesia. I'm going to draw a number on your palm, the palm of your hand, and you just need to tell me which one it is, what number it is, okay?
7,
Good.
0,
Excellent. Very good. So you're able to do that. That's good. We're going to do extinction, the extinction test, and what this is I'm going to touch, you, your legs, and you just need to tell me which side it's on. Okay. Close your eyes.
my right, left,
Okay.
both,
Very good. Okay. Somebody with neurological damage might not be able to tell me that it's on both sides. They might, after I do the one side or the other side, they might only feel that it's on one side, which would be their affected side. So I'm going to go ahead and do the soft pointy test down in a couple other areas. I'm going to do it down in your on your feet here. Okay. So just tell me if this is soft or pointy.
pointy, soft, pointy, soft, pointy, pointy, soft, pointy, soft.
Good. Okay. Okay. Just be quiet. Okay. Those are your lovely children, aren't they? Okay. So nice of them to join us. Okay. So we've done 2-point discrimination. Good. The extinction and all that good stuff. Okay. All right. Next, I'm going to check your reflexes real quick here. Okay. With my reflex hammer. Good. So I'm going to check your reflex right here. Good. 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 Triceps. Just nice and relaxed. Good. Good. All right. And your teller reflex, just nice and relaxed. Good. See, we thought I was going to have to cheat on that, huh? Good. But I'm right on the money, aren't I? Okay. All right. And your Achilles. Good. Very good. All right. Okay. So that concludes our neurological exam. You have a lovely day.
Thank you.